Check your state and facility policy to make sure you are permitted to perform this procedure. Before you begin, perform hand hygiene and follow any other instructions provided in the preparation section of this program. When restraints are to be used, be aware that nurse assistants are not allowed to apply them in all states. Refer to your individual state regulations and facility policies, and remember to follow instructions from your charge nurse, as well as these guidelines. Use restraints only after other, less restrictive measures have failed to protect the patient. Never use restraints if the patient refuses them. Use restraints only if there is a doctor's order. Use restraints only to protect the patient. Use the least restrictive type of device. Unnecessary restraint is considered false imprisonment. To apply an extremity restraint, wrap it around the patient's wrist or ankle with the foam padding or sheepskin toward her skin. Using the Velcro strap, secure it snugly in place, making sure it's not too tight. You should be able to comfortably insert 2 fingers between the restraint and the patient's wrist or ankle.
It's very important that we don't play with this IV until your treatment's finished, so I'm going to go ahead and place a mitten on your left hand just to ensure that that doesn't come out, because it's real important that we get our treatment.
For a mitten restraint, place the patient's hand in a thumbless mitten device.
I'm just going to have you slip your left hand into this mitten and secure it here.
Attach the Velcro strap around his wrist, making sure it's not too tight. You should be able to easily insert 1 or 2 fingers between the mitten and the patient's wrist. If you are instructed to secure the restraint to the bed, attach the straps to a part of the bed frame that moves when the head of the bed moves. Never attach restraint straps to a side rail. If the patient will be in a wheelchair or chair, attach the restraint straps to the chair frame. In either case, secure the restraints with a quick release tie to be used in case of an emergency. Do not tie the restraint straps in a knot. To tie a quick release knot, follow these steps. Wrap the loose end of the strap around the bed frame. Lay the loose end of the strap across the end of the strap attached to the restraint. Tuck a loop under the point where the straps cross, as if tying a shoelace. To tighten, pull down on the loop and up on the strap attached to the restraint. To release, secure the strap attached to the restraint and pull down on the loose end.
Hi, Ms. Stevens. I got this quick releasing seatbelt.
Some facilities may use a quick release buckle or airline type buckle instead of a quick release knot. Be sure to follow your facility policy.
Like this. Do you have enough room? You can see that you can move your legs.
Okay.
Miss Stevens, are you able to move your arm okay with the IV in?
Make sure that the patient can move safely. If the patient has an IV, urinary catheter, or drainage tube, make sure it is positioned correctly. Before leaving the patient, secure the call light within her reach. If the patient is in bed, put the bed in the lowest position, or if in a wheelchair, make sure the wheels are locked.
Yeah.
Thank you.
Okay.
To ensure safety, check the restraint in the patient every 15 minutes. For a wrist, ankle, mitten, or elbow restraint, check the skin condition, pulse, temperature, color, and sensation of the fingers or toes.
Yes.
I just came in to check on you, check on your safety belt here.
For a safety belt, check that the patient can move easily and comfortably. Observe any restrained patient for signs of confusion or agitation.
Your movement without the belt. Are you still able to pick up your legs and move them around?
Oh, yes. Sure.
Okay.
At least every 2 hours, remove the device for 5 to 10 minutes. During this time, check the patient's skin, perform range of motion exercises if appropriate, and assist with personal care activities such as toileting.
I brought you the book that you asked me for, and also I brought you a glass of water.
Oh, thank you.
After repositioning
I'm
the
gonna go
patient,
ahead and grab your
reapply the
glasses.
restraint,
Okay.
again making sure it's not too tight.
Here are your glasses. Now, if
Okay.
you need anything, I'll be back in about 15 minutes to check on you.
As part of your follow-up care, notify the charge nurse if the patient reports pain, numbness, or tingling in the restrained body part, or if you notice a weak pulse, cold, pale, or blue fingers or toes, red or damaged skin, or signs of confusion or agitation. Perform hand hygiene and report completion of the procedure and your observations to the charge nurse. See the follow-up section of this program for detailed information.